Sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to your Hometown Health Show, brought to you by Trilogy Home Healthcare, the industry leader with over 30 years of experience in providing home healthcare services such as skilled nursing, physical and occupational therapy, home health aides, and other specialized care to your homes throughout the state. Please tune in every other week as we bring you a range of good information from specialists in the field to help make you more informed and living healthy.
By fast. Hi, and good evening, everyone. Happy New Year. Welcome back. It's your Hometown Health Show, and I'm Yolanda Santana with Tech One Solutions, hosting here for Trilogy Home Healthcare. Today, we have the pleasure of having Dr. Jason Evans, Podiatry, as our guest. Welcome.
Welcome. Thank you. Appreciate that.
We also have Steve Levine from Trilogy Home Health.
Hello, everybody. Hi.
Hi. So we're here to announce Dr. Evans to our listeners and to discuss his specialty in podiatry, specifically with regard to wound care, heel pain, and treating diabetic patients. Welcome. Would you please tell our listeners a little about yourself and your field, podiatry?
Well, I became a podiatrist in 1998. I have my license in 1999. I did a 3-year residency in Miami. So starting in 2001, I became partners with another physician, and ever since then I've been practicing.
Okay, fantastic. So walk us, if you will, through the types of patients you see and the varying degrees of diagnosis you treat.
Well, I do see a lot of diabetic patients. A lot of wound care is what the specialty is at this point. I do see some pediatric patients with a little bit of flat foot deformity and warts, but majority of patients I would definitely say would be wound care.
Okay, okay. And what does that specifically mean for those that, our listeners that don't understand what that
Basically,
is?
wounds or erosions of the skin. Unfortunately, if they get deep enough, they become infected, become problematic. That leads to systemic problems and could be a huge problem if not taken care of properly.
Okay. So who is a typical candidate in need of wound care?
Anybody can get a wound, believe it or not. It's, more of as we get older, the circulation is much more poor here. Obviously, in the diabetics having blood sugar, wounds tend to slowly heal. When they become slowly heal like that, that's when they become infected. And again, that's when, it can be a problem at that point.
Okay, okay. And what about heel pain?
We see a lot of heel pain. Most of the heel pain that I see would be what we call plantar fasciitis, which is an inflammation of the ligament under the heel. We also have a tendency to see some Achilles tendonitis, which is on the top of the heel. In addition to that, we see a lot of children with heel pain, which is inflammation of the growth plate. A lot of physicians, including myself, think it's a fracture, but all that is just an inflammation of the growth plate, which usually occurs in patients 8 to 13 years of age.
Okay, okay. So how about diabetic foot health? How important is it for someone with diabetes to see a podiatrist?
Very important here. One of the things that I tell my patients is you need to constantly look at your foot. If you see something that's on the ordinary, or if you see something that's not healing properly, you need to see a physician properly here. A lot of patients think that these things are going to just heal on their own, and unfortunately, that's not always the case.
Okay. Fantastic information. So what would you say sets you apart from other podiatrists?
I think, me personally, I'm an on-time person. I don't believe in waiting for my patient, making them wait for an hour or two, as some physicians unfortunately have to. I like to see my patients. I like them to know, hey, don't be stressed out in the waiting room. We're going to get you in right away here, because patients get stressed out when they see a doctor, and the longer they wait, the more stressed out they may get.
Yeah, definitely. Okay. So what type of latest advanced modalities or technology and services do you provide?
As far as the wound care is concerned, I am now using it's called amniotic fluid. I don't want to give the name from what company, but I use that quite often here. And what that does is that stimulates the stem cells to basically improve that ulcer dramatically with, pretty much don't have to do anything about it except change the dressing daily here. So
that's interesting. Okay. Do you want to go into it a little bit more?
Well, basically, it's just it's from amniotic fluid. It's the newest technology they have out there.
Yeah.
And it stimulates growth exponentially. It's amazing the results that I'm getting right now here.
Okay. That's great. All right. So how do you and Trilogy Home Healthcare, our show sponsor, work together? And
Well-
if you could describe a scenario that would help the listening audience understand how people can benefit from your wound care and Trilogy's nursing care.
You go first.
Okay. Well, I use Trilogy, obviously, for home health care. Do an excellent job of making sure my patients are seen properly. They will call me up and let me know how the wound is progressing. And I need somebody to constantly tell me what's going on because, unfortunately, patients tend not to do that.
Right.
Yeah, we work in conjunction with the doc. Once he gives us an order for a patient and what he wants the patient to have done on a daily or on a other daily basis, and we make sure that we do all the observation on the patient to make sure they're healing. We use cameras to make sure that we measure the wounds. We can send the doctor a picture of the wound so if the patient is unable to see, to actually get into the office because of the pain or because they're homebound, we can actually send him the information via the either fax or by email, and he can tell us what to do from there. We also, with the nurses, we're making sure that the patient is doing a holistic idea. In other words, and I don't mean holistic like in holistic medicine, I'm saying making sure they're taking their medications properly so that way the healing is faster, make sure that they're not mixing their meds with other meds that aren't going to work, and making sure that the patient is doing all the things that the doctor had told them to do when they were in their office, because a lot of patients will come home and they'll say, "Oh, I know he told me what to do, but I don't remember." So we have written orders, and then we make sure that that's taken care of, document it, and we make sure we support that patient and let them know that they're going to get better. And as long as they keep doing the things that the doctor has told them, they're probably going to get better really quickly. And that's why we follow up with that and make sure that they get to the healing point.
Okay, great. So, how does one get an appointment?
Obviously, through email or through my phone number here, so either or would be sufficient for that.
Okay, do you take walk-ins?
Absolutely here.
Okay.
See that all the time, quite often, to be
Yeah.
honest with you. Yes.
And insurance?
Insurance, obviously, it all depends here. You know, if you need a referral, easy to get. My office staff is fantastic getting that here. Maybe a little bit of a wait here, but we ultimately will get the referral for you.
Okay, great. And what are the services that Trilogy provides if you want to, delve into that a little bit further?
And, well, as far as podiatry is concerned, we do a lot of wound care with the doctor. We also do physical therapy. We do occupational therapy for when patient needs to, if they have a boot on or they have a cast on or the doctor has ordered that it's bandaged, we teach the patient how to maneuver with that particular situation, how to, transfer from chairs, how to get up a stair if they're going outside to take the garbage out, things like that. So we help the patient work around the wound or whatever it is that the doctor's working on, so that way they can continue to heal but also live their daily life. Other things that we do medication management, we do respiratory therapy in case the patient's having breathing issues. We do all sorts of any kind of physical therapy, occupational therapy, speech therapy. We also do lymphedema therapy, which is when patients having unusual swelling in some of the peripheral areas, either the arms or the legs. We do peripheral and lymphedema wraps and things like that. So we're really helping the healing process in conjunction with the doctor's orders. So that's what we're doing. And we're also giving them emotional support. We also provide medical social workers. We also have psychiatric nurses for the people. And we also are monitoring all of the things that are going on in the home to make sure that they're safe. Because a lot of times we'll go into a home and we'll find out they don't have electricity. We'll go out and find out that they don't have water. We
Right.
find out that they're living in a situation that is not healthy for them, so we're going to integrate all of the other services that are going to help them get better and stay safe. And if we find that the situation is not safe, we're certainly going to alert anybody, usually a family member or a friend, and let them know that we've deemed this an unsafe situation. So we want to make sure that they get taken care of. Because a lot of times, a lot of the injuries or a lot of the physical things that are happening are because of an unsafe environment.
Right.
So we're going to try to make sure that that gets taken care of, and we do everything in our power to do that.
Right, great. That sounds fantastic, and I would imagine that is some of the things that set you apart from other home health agencies. Is there anything else that you would say someone, for people who don't know Trilogy, would choose Trilogy over some other agency?
Well, you have a rep like me, first of all. So, and I'm a nurse myself. I've been a nurse for 30 years, so I've got a good idea of, and a good handle on what's going on. And I usually like to meet my patients or talk to them on the phone to make sure that we don't miss anything that they may need. The other thing is that we do same-day starts. So if the doctor orders any kind of treatment for us, we go out the same day. That sets us apart from a lot of the home health agencies. Usually they will be processing the information. They may take a couple of days before they actually get a hold of the patient. We make sure we get a hold of that patient. We call them first. I do the call, and then they get called by a nurse to set up the time that they're going to come out, and hopefully they're available that day and they're open to having us come out, and we go right out there.
Wow.
The other thing is that we are we have a team approach to everything. So we're going to talk to, even if you didn't order a social worker or you didn't order a speech therapist or a physical therapist, in our team meetings we're going to talk to them and tell and let them know what's going on with that patient, and they may suggest, why don't we call the doctor for an order for PT just to make sure that that patient doesn't get into a worse situation than they're already in. So we really do those kinds of things to make sure we are looking at the full spectrum of what's going on with that patient.
That's great.
Yeah, it's great. It's very and it's very rewarding for us to be able to do that. We're very lucky that we can do that.
Yeah, it sounds really holistic.
It is.
Okay. How would people reach you if they want to ask questions about after the show or make an appointment?
They can either call our office number or my number, which is on the thing. I think, nope, they didn't put it up. My number is also available all the time. So, and we have a website also.
Okay.
Yeah.
All right.
Mm-hmm.
Do you know the website?
I do. It's trilogyhomehealthcare.com.
Awesome.
Yeah.
Okay. Well, we're going to take a quick break, and again, you're watching your Hometown Health Show. I'm Yolanda Santana, and we have Dr. Evans, Podiatry, and Steve Levine from Trilogy Home Health.
Thank you.
Thank you. We'll be right back.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily... Let's all welcome a new sponsor to the show. It's AMP2 TV, the first and only internet production company that's truly plugged in. When you're looking for a full-service internet TV radio production company, discover AMP2 TV, a full-service production company that can provide all streaming videos in studio or remotely. They offer web page development, and they use all the latest platforms to help make all your business selling points more powerful. They can do remotes or live radio streaming as well as tape productions for social media platforms and television. AMP2 TV can handle all of your television needs, including closed caption for a perfect on-air telecast. Choose from a variety of creative TV and radio packages or visit one of their many studios to get your creative juices flowing. Come and see why AMP2 TV works with many major companies including Comcast, Bravo, and Fox 29, as well as individuals and businesses of all types and sizes. To see samples of their work or to find out more, visit their website at amp2.tv. That's AMP2.tv, or call them at 866-224-5422. Feel free to call for a quote or just a consult of how to put your business on a social media platform or radio platform, or just doing a show that is covered by all platforms. Call 866-224-5422 and make an appointment. That's 866-224-5422.
Welcome, everyone. Good evening. Again, I'm Yolanda Santana, an account executive with Tech One Solutions, and you're watching your Hometown Health Show, sponsored by Trilogy Home Healthcare. And we have Dr. Jason Evans, podiatrist, and Steve Levine from Trilogy. Welcome again.
Hey,
Thanks again.
thank you.
Appreciate that.
So I think, Steve, you wanted to add a little bit, something else that sets you apart from other agencies?
Yeah, I wanted to bring up also that, and it dovetails into what the doctor does. We do a lot of skin care, make sure patients are getting their good skin care, which is obviously the largest organ on their body, so we want to make sure that they're taken care of there. We do diabetes management from all the way to training the patient on diet to how to use their AccuCheck machines or any of the newer high-tech stuff that their doctor may prescribe for them, and how to manage their insulin and how to store it, things like that, to make sure that they're doing everything properly. And we are one of the only agencies that has a WOCN, which is a board-certified nurse position where the nurses train specifically in wound care. And they can do assessments on the wounds and make sure that it is being done in the best way for the best healing process. And the WOCNs, there's about 8 of them in the entire state of Florida, and we're very, very lucky. We have about 3 of them with Trilogy. So, and they are full-time staff on our service. So when we have a wound of any kind, our WOCN goes in first and does an evaluation and guides the rest of the whole treatment program through the time that we have that patient. So it's a fantastic, nice thing that we have. So we know that we've got an expert in wound care instead of sort of just, saying, well, we're going to do the best we can and see if it heals. We're going to make sure that it does it the way that's prescribed by the board. It's
Right.
very good.
Great.
Yeah.
Okay.
It's exciting.
And why is wound care so important? I mean, I believe their diabetes, there are times when it doesn't heal and it could lead to death. Is this correct?
If it does, if it does get infected, it's called sepsis. It starts out as something what we call cellulitis, which is an infection around the skin and surrounding the soft tissue. Again, if not treated properly with antibiotics, local wound care, it could take off on you very, very quickly and lead to sepsis, which can lead to organ failure and unfortunately death. Yes.
Okay, that's what I thought.
And that's what our goal is to make sure that it doesn't get to that
Yeah.
point, and especially in the home when the patient doesn't have the doctor right in front of them all the time. So we're really the eyes and ears for the doc to let them know what's going on and to make sure that it doesn't get to that point where they get hospitalized. We want to prevent hospitalization.
That's why I try to tell my patients, if you see something, let us know, especially being diabetic, because it could take off, unfortunately, very quickly.
What would be a red flag?
Redness, pus, swelling. Being that most of these patients are neuropathic, meaning they don't feel anything, they don't know. So looking at it will definitely tell you something is wrong here to see a podiatrist or wound care doctor right away.
And what's a timetable?
They can take off in less than 24 hours. It's a bacterial infection. Obviously, fever, nausea, vomiting, that's telling you there's something else going on. And if you don't take care of it, that's what's going to put you in the hospital.
Yeah, definitely.
Right, and that's one of the advantages of having a nurse out there also, because she's going to, again, like I said previously, be the eyes and the ears, and they're going to ask those same questions that the doctor would be doing. It's a similar assessment, but they're going to see if there's temperature, if there's heat, and they're going to see also what the patient may be doing. They keep their feet up, which keeps the circulation better, or maybe they're not wearing shoes and they're walking around on concrete, and we would say, you want to cover your feet, you want to make sure you keep your feet clean, when you're walking outside, things like that. So part of our job is to make sure that those things don't happen and make sure we observe that. And if for some reason the patient doesn't want to be cooperative in those kinds of things, our best thing to do is at least let the doctor know so he knows what he's working with when he does see the patient. So that way we can at least say, okay, the
Absolutely.
patient doesn't wear her socks, or he doesn't wear his shoes when he's outside, and that may be contributing. And so a lot of patients will listen to the doctor more than they will someone else. So we want to make sure that that's reported to them, so that way we can really, really make sure we stop this before it gets to the point that he's talking about of cellulitis or sepsis.
Yeah, definitely. Okay. It's really good information, especially, those of us that have elderly
Yes.
Without a doubt.
people in our lives and
Yes.
they can't respond, so they have home health
Exactly.
aides. It's great. It's great to know, and even
Right.
for home health aides to look for that information.
Yeah.
That's why we work well
And
together.
one of the other things that we do, if they have either private home health aides or our own home health aides, we educate the people who are the caregivers. The nurses go out and educate the caregivers to see and to let them know one of the things that they need to be looking for. They may not know exactly what they're seeing, but if we say, if you see something different or something that's going to be a little, that's odd, or even if you have an inkling that something's going on, we want them to let us know so we can assess that. So that way they're like our eyes and ears when we're not there. So
Right.
it's that part of home health is educating everybody who's taking care of that patient.
Okay, great. Yeah, I realize, you have to forgive me. We have not delved into how people can contact you, your phone number, your
We can
location.
give the phone number out. I can give the phone number out.
Yes, please.
The phone number is 954-776-5700. We also have a website, drjasonevanspa.com.
Great. And your location?
We're by Holy Cross Hospital off of Commercial. It's called Bayview, so it's not too far away.
Perfect. All right. Awesome. Give that number out one more time.
It's 954-776-5700.
Great. So, Dr. Evans, I hear you're a sports fan.
I try to be, yes. According to my wife, I am. So.
And
What?
favorite sport?
Football by far.
Football?
I played collegiately. That's what got me into podiatry. Unfortunately, I had a nasty incident breaking my foot during my college years. And after that, that kind of led me down to this path here. So.
Okay. Which team?
University of Toledo.
Okay. And who do you root for now?
University of Toledo, of course. I'm a Rocket. Got to root for my team.
NFL?
Well, I mean, I'm from Cleveland originally, so I'm a Cleveland Browns fan. I know it's hard to say in past years, but we are improving, so I'm happy about that.
Okay. Perfect. All right. What else can you tell us as far as podiatry and what our sports fans should know? Diabetes as well.
What would they know? I mean, if there's a problem with your foot here, obviously, something doesn't improve, obviously, heel pain, ingrown toenails, infections. I mean, we pretty much see it all here. So.
Yeah. Okay. Yellow toenails.
Yes, we see a lot of fungus
black.
toenails. And they are treatable. A lot of patients think that it's not because they use an over-the-counter product, but the products they have now and the technology is much more improved and safer than it's ever been before.
Mm-hmm. Okay. And what else? Let's see. I know that there was a lot of athletes out there that they don't go and see a foot doctor. What would you recommend as far as if, say, they go to their general physician?
I tell patients as long as it's improving, regardless of the doctor you see, that is a good sign. When it gets worse, it doesn't get better, obviously something else is going on. Whether we take x-rays, MRIs, physical therapy, we just try to take it step by step and try to get you back to normal activity as soon as possible.
Okay. I myself have had bunion surgery. Do you see that as something that elderly patients have
Again,
done?
it all depends here. Keep in mind that when you want to do surgery on a geriatric or older patient, there's a lot of factors that go in. Do they have hypertension? Do they have thyroid disease, obesity, diabetes? So you really want to pick and choose when to do surgery, when it's right and when it's not right here. So their health becomes an important factor in determining if surgery should be needed or not.
So then at that point you would I guess to physical therapy or preventative care?
It all depends here. You get other doctors involved. If a patient is really adamant about doing surgery and surgery is an option, you talk to the primary care, talk to an orthopedic, talk to a physical therapist. Is this patient healthy enough to have this surgery, and more or less, are they healthy enough to finish it? Because some of these surgeries are long hauls. They take a lot of time here, and it can be quite painful sometimes too. So.
Okay.
And I wanted to add that, one of the things that I have found as a nurse for 30 years is people are embarrassed about their feet. Okay, when I worked in the hospital, I would always do a full assessment on my patients, including their feet, looking at their nails, looking at their heels, looking at their ankles, and they were always very embarrassed. They'd say, "Oh, I don't want you to look at my feet," but foot health is very, very important.
Yeah.
Absolutely.
And what I used to say to them is, you walk around on these all day. You don't think they're important? I think they are. So let's make sure. And especially women who wear heels, high heels, the 8-inch stilettos. My mother wore high heels while she was pregnant, okay? And then she complained about having sore feet. My father used to say, let's figure this out. Is it the heels or is it the kid? Who knows? But the fact is that you, as a nurse, we do a full assessment, including the feet, even if they haven't seen the doctor. And then if we see something, we're going to say, you need to see Dr. Evans.
Definitely. That's a good point.
Yeah.
Let me ask you, varicose veins,
Yes.
is that in your field?
I don't see that quite as often. Again, because I have an older population, a lot of the patients don't really want to deal with that. But there are certain, treatment modalities, compression stockings, water pills, elevation. When it gets to more the younger population, I would refer them out to maybe a dermatologist or a vascular surgeon.
Okay.
So.
Okay. That's interesting. It's good to know. As far as heel pain and that kind of thing, what would you recommend for an aging population and that has heel pain or has
Good shoes.
spurs?
Good shoes, first of all. That is everything here. You just take it, each patient a different approach here. Is it anti-inflammatories? Is it cortisone injections here? Stretching modalities, physical therapy? Everybody's different. So you take each patient differently and you just take it step by step and see what approach works best for them.
Perfect. All right. Well, again, it's been fantastic having you here.
I appreciate that. Been great to be here.
Wonderful. Dr. Evans, could you tell us one more time for our listeners and our viewers how to get a hold of you?
Phone number, 954-776-5700. My website, drjasonEvansPA.com.
Okay. Thank you so much, Steve.
Thank you. Thanks for having us.
Thank you, Dr. Evans.
Thank you for having us. Appreciate that.
Thank you, Trilogy Home Healthcare. You've been watching your Hometown Health Show. Again, I'm Yolanda Santana. Have a great evening.
Trilogy Home Healthcare invites you to call our offices before making a decision about your home health and rehabilitative care. Different from other agencies, Trilogy offers specialized service that other agencies don't, providing exceptional care. That's who we are and what we do. Call us at 866-599-4959 or go to trilogyhomehealthcare.com. The opinions expressed on the preceding sponsor